Thank you, Judith. We appreciate your support and leadership and look forward to emboldening staff and help deliver the vision of the NHS we all want to see. We thank the Minister and Judith for taking time out of their very busy schedules today to attend this afternoon. Thank you. Quality should underpin all our services. As Director of Quality and Deputy Chief Medical Officer for Wales, our next speaker is uniquely placed to discuss how quality plays a key part of delivery of AIMS. I'd like to welcome Professor Chris Johns.
Thank you very much, Inder, and thank you everybody for letting me spend just a few minutes with some very clinical reflections on the situation we've got. But we have to get on the side of the solution. And one area where there's emerging evidence is that some of our pressures are caused by probably a lack of attention to secondary prevention in recent years. We know that following the pandemic, excess mortality in the UK across a range of different clinical conditions is still higher than it should be. And we also know from evidence around blood pressure management, diabetes management, and several other clinical pathways that the levels of effective secondary prevention are far too low and almost certainly contributing to the events that we're seeing in our emergency units and our ambulance services. I do think fracture liaison services are now critically important because investing in the secondary prevention of fractures in people who've already suffered an osteoporotic fracture is highly cost effective. It is an invest to save activity. It saves money, but also it will deliver a rapid return. The evidence is very strong, isn't it? That investment in prevention, secondary prevention, brings a very rapid return. So now, as part of our approach to the challenges we face, we need to invest in fracture liaison services. And I know that in Wales, we've managed to keep them going, but I know they're not adequate and not everybody is getting the secondary prevention they should get. But I think a focus on this now is really appropriate because it will help us address the challenges that we face. And it is the ultimate value-based healthcare. It is relatively small investment with a very, very significant return on that investment. And the other reason why it is so important is it is a key part of the frailty pathway. And I was just talking to the minister last week in another meeting that we were at about the challenge of frailty, frail patients admitted to hospital, staying too long in hospital, who we know are becoming deconditioned and in the end requiring, in many cases, social care. The majority of our patients in our hospital systems at the moment are frail. So we know how difficult it is to get frail people out of hospital once they're admitted through the front door. The challenge is keeping them out. And obviously, secondary prevention to prevent osteoporotic fractures is a key plank in that. So for me, it is a vital part of our approach to the frail patient, the responsibility we have to enable them to continue to live independently with their families as they would wish to at home. This is the time to strengthen it, invest in it, and make it deliver for us all. Thank you very much.